You are listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I am your host, Celine Yeager. Each week, I bring you advice from athletes, scientists, researchers, and other experts to help you feel and perform your best, no matter what your hormones are doing. This show is a production of Live Feisty Media. Hello, strong, feisty women. I hope you all are well. So today we're actually going to talk about something that I really knew very little about before recording this show. And honestly, I should know more about. Namely, how to get back to sport after gynecological surgery like hysterectomy or myomectomy or one of those uterine surgeries, because they are extremely common. In fact, hysterectomy alone, more than 1/3 of women in the US will have had one before age 60. And way too often, doctors don't understand that quote unquote regular life looks different for active or athletic women than it does for the general population. So they'll say, you're good to go after a few weeks. And reality, you're not good to go when where you're going is powerlifting or doing some kipping pull-ups and double unders or trail running 10 miles. And if you try to get back to your regular life without proper rehab, it can be a real struggle, which is where this week's guest, Dr. Jocelyn Wallace, comes in. As a powerlifter and CrossFit athlete herself, who has also had multiple gynecological surgeries, as well as being a pelvic health physical therapist, Jocelyn has devoted her professional life to helping women rebuild strength after surgery and bridge that gap back to their active and athletic lives, or as she says on her website, we get you moving after surgery without prolapse, pain, or peeing yourself. And to that, I say, amen. I'm super grateful that she came on and shared her wisdom with us in this conversation. I hope you enjoy it as much as I did. You can find more about her and her work at drjocelynwallace.com. I'll put a clickable link in the show notes so you can find it there. All right, as usual, speaking of finding, you can find us at Feisty Menopause on Instagram and Facebook, so go on over and give us a follow. You can also join our private Hit Play Not Pause Facebook community, where there's about 31,000 women just like yourself, sharing stories, helping each other out. And sign up at feistymenopause.com for my free weekly 40+ women's newsletter. It's not just menopause, it's everything 40+. A million thanks, as usual, for the kind reviews and 5-star ratings that continue to come in. They help me support this show and get great guests for you, so I really do appreciate it. And before we get to it, just a really super quick thanks to Previnex for their longtime support of the show. I got a review from a listener who was like, I never submit reviews, but I have tried everything under the sun and nothing has helped my joint pain. So she pretty much just reluctantly tried Joint Health Plus because it had a money-back guarantee, and she was shocked, as she says, that her hip, back, and shoulder pain practically vanished. I hear you. I love this stuff myself, so thanks, Previnex. I really appreciate your support of the show and all the women out there. All right, enough of me. Let's have a few words about those awesome sponsors and get on with the show. Okay, well, Jocelyn, I'm very glad that you reached out to me because these are topics that I know affect a lot of women in the audience, but I actually don't know all that much about. Like, especially like, I don't think we've ever talked about myomectomy on the show, and all these things they definitely affect all women and really affect active women. So thanks for reaching out to help illuminate some information on this.
Yeah, thank you so much for having me.
So first, I would love to hear your own story because, in
Mhm.
doing some of my background research, it looks like you had maybe a couple of surgeries yourself. And, what were your history with fibroids? What were the surgeries and rehabs like? Like, what brought you to this work?
I was diagnosed with fibroids in my early 20s. I'm in my mid 30s now. It's
Okay.
been my whole adult life. My first symptoms was severe heavy bleeding. This was before I was a physical therapist or anything. So I ended up having an open myomectomy while I was in physical therapy school. So that's where they do like a C-section type incision along
Oh,
the bikini line. And
okay.
they go into the abdomen and remove the fibroids from the uterus. I didn't do any research. I didn't have any of the skill set yet. I didn't know anything about this. I did it all
Wow.
the wrong way. Recovery was atrocious. I was a lifter at the time. I've been a lifter my whole adult life. So getting back into lifting was really challenging. I ended up having some injuries and some setbacks that I have since learned can all be avoided with
Did they give
proper
you
guidance and the resources.
I mean,
No,
like, wait, oh.
nothing.
Okay. Okay.
Nothing. So that experience was my inspiration for getting into pelvic health. So I've been on this road for almost 10 years, wanting to specifically focus on treating this population of all the pelvic surgeries not related to perinatal stuff.
Right.
So because that population gets so much attention, which is great, but there's nothing out there for women going through these surgeries that are incredibly similar, but may
Yeah.
not want to talk about all the baby stuff. That may not be a part of their life. They
Yeah.
want to get back to their sport. Their stuff is about them. So those are my people. That's who I was. I didn't have any other resources. My fibroids ended up coming back. I had my second open myomectomy in 2021.
Okay,
So
recently.
along that timeline, I had begun practicing in pelvic health. I had a few years of experience. It had been about 5 years of practice by that time. And I ended up having another open myomectomy to remove 47 fibroids. So at this
Holy
point,
crap.
I've had 54 fibroids removed. Um, my case is severe, but at that surgery, I was able to apply everything that I've learned, go through my own rehab process instead of just kind of winging it, which is what the doctors will tell you is to just ease back into it at 6 weeks, is the usual advice. And that experience was worlds different. Much easier to transition into exercise, much fewer setbacks. I did end up conceiving 3.5 months after that surgery, had a pregnancy and a C-section in 2022. And to cap off
You've
the
been opened
story,
up a lot.
yeah, I'm having a hysterectomy in 2 weeks because my fibroids came back in pregnancy. So the journey is almost over.
Wow. Oh, wow, Jocelyn, that is a hero's journey you've been on. Okay. So so let's actually just compare and contrast a little bit with your
Yeah.
stories. Like, because when I did a little Googling, it's like you find this boilerplate advice, right? Recovery from myomectomy can take between 4 to 6 weeks. During this period, you need to avoid any physical activity such as heavy workouts, including jogging, cycling, and heavy lifting. And then what? Like, that's it. Like, that's all I found.
Yeah.
It's like, okay, so after 6 weeks, now what? I can go to CrossFit? I mean, what did you do the first time? And then what did you do the second time?
Yeah. I was not doing CrossFit during my first surgery, so that can be kind of a
But you were
confounding variable.
lifting, right?
My
Yeah,
first
okay.
surgery, I was powerlifting.
Okay.
I've done powerlifting, strongman competition, and now I primarily do CrossFit.
Okay.
At the time, I was just powerlifting, and I just started easing back into it. I went to my first workout at 5 weeks after that surgery because I did get cleared a little bit earlier than typical for my first surgery. My first workout, I went into the gym. I did some empty barbell squats,
Yep.
and then I just basically followed like a 5x5 program,
Okay.
just adding weight little by little. But I knew nothing about how to make sure that my core was ready.
So five
So
sets
I
of
would
5 reps kind of thing. Yeah.
yeah, so
People
I
don't
would
know.
consistently get like swell up like a balloon after, get a lot of pain, have a setback. Swell up like a balloon, get a lot of pain, have a setback because I was just trying to ease back into it. Like I was
Yeah.
told and not rehabilitating these tissues that had been majorly disrupted by a large incisions. Incisions can be like 4 to 6, 7 inches long for the open surgeries. So it was just a back and forth, and I didn't feel normal until 4 to 6 months after my second myomectomy. Um, and this can vary so much too. Something I like to emphasize for people is that it depends what you were going through before the surgery too. We can each have the exact same surgery for the exact same size and number of fibroids, but if person A had severe anemia and could only exercise 2 weeks out of the month, they're going to have a different journey than somebody that was able to be
Right.
consistent and train. So I like to caveat that before my second myomectomy, I was training 90 minutes a day. I was coaching CrossFit classes. I was in it all the
Yeah.
time. So I went back to the gym after a week, upper body, bodybuilding, like seated dumbbell kinds of exercises and rehab stuff. I did my first WOD at 3 weeks, very, very scaled. And I was doing CrossFit regularly again by 6 weeks. So I did match that 4 to 6 week timeline. But the thing I like to tell people is like you need to start early, but progress very slowly. So looking from the outside, it probably seems like I was recovered at 6 weeks, but I was not ready for kipping. I was not ready for most gymnastics yet. There was a lot of stuff I wasn't ready for that takes longer to progress toward. So there's any exercise you can name, especially in something like CrossFit that's so dynamic. There's a best progression to
Yeah.
get back to the thing. So kipping pull-ups, for example, that's a common one that people jump into way too soon. You need to be able to hang from the bar and maintain a hollow hold. You need to be able to have strength and extension to get in the arch position. So being ready to do a GHD sit-up is very different than doing a sit-up on a NAB mat is very different than doing a sit-up on the floor. So you need to build that strength methodically. And that takes longer than 6 weeks for everybody, even in a best case scenario situation.
So where does the pelvic floor work intersect with all this?
So fibroids in the world of fibroids, I also work with people that have endometriosis. There's a lot of different
Yeah.
reasons to have similar surgeries. But in the world of fibroids can get very large. The largest I've worked with is someone that had a 22 centimeter fibroid removed. So about 10 inches or so,
Wow.
huge. That can have pelvic floor impacts that having the surgery doesn't just, it's not a snap of a finger, those problems are resolved if you've had pressure on your
Right.
pelvic floor for decades,
Right.
in some cases. There's a lot of kind of undoing the results of that. So it's all based on what kind of symptoms women have before surgery. So if your fibroids were causing leaking, your journey back to exercise is going to look different from somebody whose fibroids weren't causing pelvic floor issues. Everybody needs the abdominal side of it because you're getting your abdomen cut open for a lot of these surgeries, but the pelvic floor piece can look different from person to person. In contrast, women with endometriosis that maybe are having a hysterectomy as part of their endometriosis treatment, they
Yeah.
tend to deal with a lot of tension, a lot of chronic pain. So their recovery priorities are going to look different from somebody that was maybe having leakage.
And if you have had, my understanding of how like the whole cylinder of the core and the pelvic floor kind of work is that if you compromise the core, that puts more pressure on the pelvic floor, correct? So
Yes.
isn't it conceivable that somebody who maybe didn't have pelvic floor pressure or maybe didn't have like, an extreme situation with their fibroids would still maybe consequently end up with pelvic floor problems because of the surgery itself? Is that
Yes.
reasonable?
Yes.
Okay.
Absolutely. Absolutely. As I'm sure you can imagine, these things aren't well researched.
Yeah.
And they're often written off. I saw there's a YouTube video out there from a physician talking about like the pros and cons of hysterectomies, and she says, "I've never had anybody have a complication from a hysterectomy," or her like verbatim words about that. But it's because they're only looking at that 6 week period. They don't get to see what the woman is struggling with 6 months after surgery when she's just spinning her wheels trying to get back into things and can't figure out why she's peeing her pants when she's doing double unders now when she didn't before. And that link never gets made. It never gets attributed to that surgery 6 months or 12 months ago that you
Right.
didn't get proper rehabilitation for. So absolutely that can be a thing too. Hernias
Yeah.
too are a
Yeah.
big
And
complication.
that's hernias are a big complication of what? Of
Any of these surgeries
oh, they are.
of
Okay.
getting into things too quickly. So
Gotcha.
umbilical hernias are quite common, like 6 to 12 months after surgeries when women just get told to ease back into it and get no guidance on what they aren't ready for.
And for a minute, let's because I think sometimes people conflate like hysterectomy and oophorectomy. That
Mhm.
and those are two different surgeries. And even though hysterectomy can sort of hasten menopause and cause menopausal symptoms, it doesn't automatically toss you into menopause the way that oophorectomy or a
Mhm.
complete, surgery does. So for a moment, let's leave sort of that menopausal piece off the table a bit and just talk about the mechanics of these surgeries. Um, what do you do to then help women not just blindly ease back into it, but like how do you help them strengthen all of this so they don't run into these complications?
So thank you for making that distinction because a lot of people don't make that clear that having hysterectomy does not mean that you're going straight into menopause. That's a major misunderstanding. Um, but I work solely virtually now because I only work with this population. So I work with
Okay.
people all over the world. So the way that my process has developed over time, it's a series of evaluations that take place on video alongside remote programming. So we have an app that I use where they have their exercises, and that's where we communicate about their symptoms and stuff. So at the initial meeting after someone has surgery, in my perfect world, I'm meeting with them about a week after surgery.
Okay.
Sometimes I work with people that have complications way down the line. But in my perfect world, I get you right after
Yep.
surgery. And we do an evaluation to see how are your muscles firing? How can you move? What are you ready for? What are our priorities based on how the surgery has impacted you so far? And we start work. We start doing the thing, which at the beginning looks very much like pelvic floor rehabilitation. So getting your core muscles firing again. If anyone listening has ever had like a knee surgery, the way that your quad just kind of goes on lockdown and does not work.
Yeah.
Similar phenomenon happens to our abs and our pelvic floor. So before you can start doing, you have to get those muscles just active, rebuild that connection again, which for most people can come pretty quickly, but for people with more complex cases can take around that 6 week mark. So that person's absolutely not ready at 6 weeks to just go lift a barbell,
What does
even though
that
some
look
people
like?
may be.
Like if you were having me try to do that, get my abs back online, what does that actually, what do you do?
Yeah. So the thing that works the most often for the most people is learning to coordinate the abs with the breathing.
Okay.
So when you inhale, you should be able to feel your pelvic floor descend alongside your diaphragm, and your abdomen should relax and expand a little. Not a huge expansion, but it just should expand a little bit with an inhale. And when you exhale, your pelvic floor should come up and your abs should come in.
Gotcha.
And the abs should come in evenly from the pubic bone to the rib cage. Versus sometimes something you'll see is someone can only feel or use their upper abs. So you'll see
Mm.
them do like a little mini crunch under their rib cage. A lot of people struggle with feeling their pelvic floor at all. Sometimes you'll see like a flicker at the abs, like it'll be jerky or twitchy instead of being able to make an even and smooth contraction. It has to be even and smooth and able to contract before you can do loaded exercise.
And how do you get them there? Just repetition?
Yeah, most often the thing that works the most often for most people is just practice. For most people, it clicks on within a few weeks, and then we're able to start the typical progression I use. Then we're able to start doing some upper body work. Then we're able to start doing some lower body work. Then we're able to start working in some impact. And depending on their sport and what they do, we might be working on like catching at the bottom of a clean or starting to do run progressions again. It just depends on the person. But that's kind of like best case scenario progression. Some people really struggle. So for the people that really struggle, they might need, like with any coaching, different cueing works for different people. So some people need, I work with like balloons and beach balls a lot. So trying to fully exhale, get like every ounce of air out of yourself can help you to feel that deepest contraction. So sometimes someone needs a cue like that. Some people need more tactile work. So I work with a lot of like wrapping a band around yourself so you can feel where your body's moving in space. Some people, especially people with pelvic floor issues, if they have a lot of trouble feeling those kinds of sensations, some people really thrive getting in a pool when they're ready, or a hot tub or a bathtub. They can feel that kind of like weightlessness, and that can help to feel the motion more. Some people do well with internal work, so they make pelvic wands that
Mm.
you could do internal massage with and stuff at home once someone's cleared, of course, like their internal incisions are healed, if any. But some people thrive with that more kind of internal tactile sensation. So it really just depends. But for most people, it happens just with simple breath work.
Yeah, I think that's so underappreciated. It comes up a lot on this show, especially when we talk about pelvic floor health, is the
Mm.
breath work and the coordination. And I mean, I'll tell you, I think, and it's because I was an ultra endurance mountain bike racer for so long and was so used to like literally holding it for hours, my breath I was trying to use an app to sort of like practice some of this, like what you're talking about, like taking that breath and having the pelvic floor descend. I had never done that. Like it always, like it was
Yeah.
always just up, you know? And I'm like, what do you mean
Yeah.
it's supposed to descend? And it's just, it was actual really practice for me. And I still to this day, like if I don't do it, like it just, it's always up, you know, because that's just kind of what I got
Yeah.
so used to doing.
Yeah, yeah. It can take a lot. That's a common thing that people struggle with. It can take a lot to find that descent again. And something that I think it's neglected about the pelvic floor a lot, the muscle is just like anything else. So we also have to consider the sport specific demands. Like, is
Mm.
it ideal to hold your urine on a mountain bike for hours on
For
end?
8 hours,
No.
probably not.
But do you maybe need that skill for performance in your sport? Yeah, maybe. Just like I went to Cirque du Soleil last night. It's like, is it ideal to do a crazy drop from 100 feet and catch all your body weight on one shoulder? No. But do their shoulders need to be prepared for that? Yeah. So those are things that I think lack consideration sometimes. We don't all need our pelvic floors to do the exact same thing. It depends on your sport and your life and your goals and what you're experiencing.
So do people come to you, I mean, you gave me the ideal scenario, but I imagine people must come to you who were like yourself that first time and didn't get the advice and now they're like, what is happening? I am leaking, I'm doing these things. Like how do you reverse engineer and help them?
Yeah, absolutely. I unfortunately end up working with a lot of people that have had maybe multiple surgeries and never got this kind of care and now have complications from that whole history. I always say we're a whole human. You're not just the surgery that you just had. Everything that's happened to you before affects it too. So it just depends on their symptom presentation. So a common example that I see a lot of are people who've had numerous endo excision surgeries and have now had a hysterectomy, for example, and they're still dealing with chronic pain. They often deal with a lot of pelvic floor pain, a lot of bladder pain, stuff like that. So for them, the thing they usually do need to work on is that descent.
Mm.
They're usually, because they've been in chronic pain for years and years and years, they're usually very much, they need to be able to descend and get into a relaxed state. So they're usually working on very different priorities versus like getting back into kipping gymnastics exercises.
Mhm.
That's usually lower on their priority list when they're in pain like that. Another example is like the person that's had numerous abdominal surgeries now has a hernia that didn't, maybe it came from the hysterectomy directly, or maybe it just didn't speak up until they had their surgery, and that was like last straw. For that person, it's the similar progression. It just takes longer. We're going to have to take a lot more time in their core. They might have to start with deeper regressions than somebody that hasn't been through all of that. It can just take a lot more time to work through it all and get those muscles. For some women, they've never used those muscles appropriately in their entire adult life because
Wow.
it's just been one thing after another. Like in someone like in my situation, my whole adult life has been surgeries, one
Yeah.
thing after another. If you don't rebuild those skills, you're they don't often just turn back on by themselves. So it's just often a longer timeline to get it going again.
What are the consequences of not having that descending pelvic floor and that rhythmic core and diaphragm and pelvic floor?
So the most common consequence is pain, tension, pelvic pain with sex, because those muscles just are never in a relaxed state. Um, and like any muscle, our muscles need to elongate to get the strongest possible contraction.
Mm.
So if someone lives for years with their pelvic floor muscle constantly contracted, something that can happen is they eventually develop weakness because a chronically tight muscle is a weak muscle. It needs to be able to descend to fully build strength. So sometimes leaking can be the first consequence of that. And the answer in a scenario like that is not to just try to strengthen your pelvic floor. You need to get the pelvic floor to descend so then you can strengthen it. It's kind of like if you did a bicep curl with only a few degrees of elbow flexion, you wouldn't build any strength in your bicep. You need to straighten your arm to strengthen your bicep.
That's a great, great analogy. And full candor, like I developed, and I think it was everything. It was neuromuscular and muscular, like, and menopause, like urge incontinence. So I would get off my bike, and before I could even punch in the code to the garage, it was like peeing myself. Like I just couldn't even hold it anymore. And it was just my body was getting so conditioned. Like the moment you get off your bike, you must pee. And then I couldn't hold it. And like it was a whole mess. So it was just trying to orchestrate this, as you're saying. And And what you hear is, oh, you must do more Kegels, but that's like the last thing that I
Yeah,
needed was to like hold it longer. I could hold it for a long time, but that muscle had become weak from all that tension.
yeah. And there's such a neurological component too, like that distinction between urge incontinence and stress incontinence and mixed incontinence, which is both, needs to be made to even initiate a treatment plan.
Can you explain that?
So urge incontinence can be purely neurological for some
Mm.
people. So it can just be habitual, like off your bike means you need to pee and you need to pee right now. And putting a
That's
pattern interrupt into that can often be a big part of solving the problem. And then there's also people like pure stress incontinence is just you urinate when your pelvis is under pressure. So
like
when you
jumping
cough,
rope
laugh,
or that
sneeze.
kind of thing. Yeah,
But it's not urgency. It's not sudden onset. It's not
gotcha.
rushing to the toilet and not
Gotcha.
making it on your way. But a lot of people have both. A lot of people have a combination of both. But typically, the thing that works the best, the kind of progression that works the best for someone that has mixed incontinence, is dealing with the urges and dealing with that pelvic floor distension or descent before worrying about any kind of strengthening or addressing the stress incontinence piece of it.
So what does that look like? Can you take me through the progression of that? Because I know a lot of people struggle with that.
Yeah. So the thing again that works most often for most people is first just understanding what urgent incontinence is and recognizing that that's what's happening to you versus being in the thought process of, oh, I just have a weak pelvic floor.
Yeah.
So if you're recognizing that that's what's happening to you, finding the pattern interrupt that works for you. The thing that works for a lot of especially athletic people, the nerves that supply our pelvis also supply our calves and ankles, the muscles down there. So just stopping, taking a deep breath, and doing some calf raises, just pumping up and down on your tippy
Really?
toes can help to redirect that urge and give you those few seconds that you need or those few moments that you need to make it to the bathroom without peeing.
Wow. Okay. That's cool.
So it doesn't work for everybody, but
Yeah.
trying that can sometimes be what it takes to shift, to make that shift and make it to the toilet. And then if someone also has, a lot of people in this situation also have the problem with finding descent in their
Yep.
pelvic floor.
Yep.
Um, and that's all about finding the cues that you resonate with. So if you're not resonating with breath work, if you can't feel it when you try to breathe down, I've sometimes had people hold a hand mirror and look at their vulva. When you inhale, you should see the vulva descend a little bit, like it's a little movement. When you
Hmm.
exhale, you should see it come up a little bit. Some people thrive with feeling that, we're looking for that visual
Oh, that's interesting.
information.
Yeah, I had Kim Vopney, the vagina coach, on the show, and she that's her handle. She has people, and that's when I realized that I had no idea what my descent that I wasn't descending. Imagine picking up blueberries with your, and I'm like,
Yeah.
how? It's just such a it was such a moment of disconnect. I was like, oh boy, I need some work. Yeah,
Yeah, and they make tools, they make Kegel weights, they make things that you can
yeah,
insert to help give you that tactile sensation. They make pelvic floor trainers, LV, PeriFit, or some of the big name brands, and they're getting better and better. A lot of pelvic PTs don't like them, but I think they can have a place for helping people
yeah,
feel those sensations.
yeah. Especially, I mean, if you can't feel a muscle, if you have no proprioception, then you can't do the work, right? It doesn't matter what the
Yeah.
muscle is. And
Hmm.
when it's hidden deep inside you, I think it becomes exponentially harder. Um,
Hmm.
so then what about people who, and we hear from that too, and I think this is where we can intersect with menopause a little bit because muscle and connective tissue strength declines, during the menopause transition. People do lose some of that. Estrogen, when it declines, it also leads to, like the GSM, the whole syndrome of menopause. So all of a sudden, and I hear this a lot, a woman she's been a lifelong runner and suddenly she goes for a run and she's wet, she comes back and her tights are wet, or she goes to gym and
Hmm.
it's the same thing. Like, how do we help them?
Yeah. First of all, something I'd like to offer clarity on is there's little, almost no menopause education within the base pelvic health
Of course.
education. The entire curriculum, in my experience, is all about pre and postpartum. No mention of fibroids, no mention of hysterectomy, no mention of myomectomy. It's atrocious and something that I hope to fix and or be a part of fixing in my career. So first, making sure that if you're seeking help for these things, you find somebody with this kind of knowledge that has pursued external education around these topics, because a lot
Yeah.
of PTs won't even know the way that menopause might affect pelvic floor symptoms, and you'll be spinning your wheels trying to fix things from a physical perspective that you might need hormonal support. You might need different support. So I'm especially working with women who've had hysterectomy. I see every side of this often, and hormonal crashes, whether it's from having an oophorectomy or just from having surgery and the ovaries kind of slowing down, can absolutely create a severe worsening of these kinds of symptoms or kickstart them for the first time ever. And those women need hormonal support, or at
Yeah.
least they need to explore hormonal support. So people do amazing getting vaginal estrogen if they're not comfortable, they don't feel ready for systemic treatment. They also do amazing with getting their hormones addressed in general. And it can do wonders for all of these same kinds of symptoms, for urgency, for stress incontinence. It's a
Yeah, we
huge part of the
recommend
picture.
vaginal estrogen because it's, I mean, no matter
Yeah,
who
it should
you
be over the
are, you
counter.
can, thank you for saying that. It really should be. It should be. I mean, birth control pills are over the
Yeah,
counter. Like, why not? I mean,
yeah.
it's,
Why can we buy Plan B at CVS, but you can't buy?
yeah, vaginal estrogen, which is just,
Yeah.
yes, well, we'll just leave that on the table for now. But it is very, yeah, it's very helpful with those things. And I'm glad that you mentioned that a lot of people aren't trained in that because it's really important.
Mhm, mhm. And if you're like, if I'm a big fan of pelvic floor physical therapy, of course, that's not the end all be all. If your system, especially if it comes on suddenly, so something I see a lot of is women have their surgery, they have a hysterectomy in particular, and they were doing fine before, but maybe a few months after surgery, they had this just all out crash. They
Hmm.
develop every symptom of perimenopause out of nowhere, like the snap of a finger. That is
Yeah.
not the person that just needs more pelvic floor work. What I do for those people,
Yeah.
I support them in maintaining as much of their health as they can. So,
Yeah.
in adjusting their workouts when they have joint pain all over their body, adjusting in a way that helps them maintain what they've worked so hard for so long while they're going through the medical side of it. But it's
Yeah.
not always pelvic floor, a physical pelvic floor problem.
Well, you had mentioned, I was listening to one of a podcast that you were on before that so often practitioners, physical therapists included, won't even mention the pelvis, which is a great
Mm-hmm.
point. It's like we commonly talk about everything but all the activity, and I think this gets lost in all of these conversations, until a woman starts peeing herself. Like your pelvis literally is involved in everything, right? Like why is it so generally neglected before we run into trouble?
Mm-hmm. I think it. I think the reason why it's so neglected is because it's such an intimate area. We're not
Mm,
taught to communicate openly about it. There's a lot of shame around the kinds of things that you can experience related to your pelvic floor health. So people don't get help until it's critical level, or until they've lived enough life to not care about all of that. But for a lot of people, their problems actually started when they were in their 20s or 30s, their
yeah.
teens in some cases, and it just took life experience to finally be comfortable opening up about it. Um, but our pelvis is our foundation. Like if you think of the foundation of a house, like if something's wrong with the foundation of your house, the sooner you address it, ideally, the better your outcomes are going to be. Something that the reframe that I think works really well amongst athletic, active women is thinking about pelvic floor problems like a performance leak. So it can be so easy for athletic women to just cope with the aches and the pains and the niggles and the little things that you can have. So to reframe it as, if you address this leakage or you address this urgency, it's going to translate to better athletic performance. It'd be such a powerful motivator for getting people to take action sooner, and also enjoy the action they're taking more, instead of feeling broken or destined for catastrophic problems. It's like, no, I'm addressing this leakage because it's going to make my squat stronger, because it will. It's
Yeah.
a pressure leak. You'll perform better if you address these things sooner. Um, so catching things early is key, and a lot of stuff gets neglected as potentially being contributed to by pelvic floor issues. So we think leakage, we think urgency, we think incontinence, but back pain, if it's not
Mm,
going away within a month or two of traditional approaches, pelvic floor. Like look into how it might be related to your pelvic floor, especially if you have history of disruption to your abdomen of any kind. Hip pain, constipation is a major risk factor for pelvic floor problems. So getting help for constipation early.
mm,
And then if you're also in the time of perimenopause or menopause, getting the treatment for the hormonal side of it and noticing the onset, or not noticing but not normalizing the onset of joint pain all over your body, or things like frozen shoulder, these things that are can very much be linked to hormones and get pushed to this. Like I've seen women go through frozen shoulder physical therapy for 2 years
oh,
before anybody push them into getting hormonal assessment whatsoever. So noticing when your body doesn't feel right, when your whole body doesn't feel right, when
right.
you don't feel like yourself, when things are changing, noticing that kind of stuff sooner and just knowing who to go talk to about it can be incredibly powerful.
Yeah. Yeah, I had an arthritis specialist on, and she made that point too. She's like, "When everything hurts, that's not normal." She's like, "If you have a knee that is
Mhm.
acted up because you ran like whatever, like that's not necessarily hormonal, but when you have that all over, feeling like
Mhm.
that's usually
And
like a
everything's
sign."
changing all at once.
Yeah.
That can be a red flag. And that can also happen with the inside the pelvic floor. The pelvic floor can be a piece of that. Like
Mm.
all of a sudden you wake up and your hips feel stiff all over, and you also feel tense all the time, and your back hurts when you're standing when it never used to do that. That can be a cue to go and look at how your pelvis is functioning within what you're doing.
Yeah. Yeah, because I mean, it's amazing in 2024 that I still hear this, but women's doctors will be like, "Well, what are you doing deadlifting?" I mean, they kind of right? I mean, they do, they blame
Yeah.
the training, and I'm
Yeah.
just like, "Is that actually the answer?" I don't think that's the right answer.
Yeah, it's very much not the right answer. And another big part of why I'm so passionate about this, because when you have a hysterectomy, for example, if you go on YouTube and look up hysterectomy
Mm.
physical therapy, the most popular videos will tell women that they need to walk and swim for the rest of their life, never lift heavy again, never do, active sports again. And we don't have a single shred of evidence to say that that is the case. Women can do whatever they want after these surgeries, but when you hear something as extreme as that, it puts so much fear into the back of people's heads and keeps them from engaging in sport the way that they would love to be able to. And that has life altering impacts for the rest of their forever. And
Yeah.
women having hysterectomies, like my average client is 45 ish. She still has decades upon decades ahead of her to express herself physically, and to take that away from people, or to just stand by while people lose their physical confidence because of what they hear about these surgeries, is not something that I want to see happen anymore.
Amen. I mean, we have a generation of women, and they're in the audience, and I know many are listening, who have had many women. A hysterectomy is a very common surgery, and the advice that they've been given it for decades is lacking. So, putting it gently. Yeah, so
Yeah,
I'm very
it's
glad that women
very
like
bad.
yourself, because I just talked to another woman. The show hasn't aired yet, but I can't remember how old she was, 28, maybe she had like a prolapse. And her doctor literally said,
Mhm.
like you said, nothing strenuous, like for the rest of your life.
Mhm.
How is
At
that the
28,
answer?
you've only had 10 adult years. Your entire adult life, you're not supposed to do exercise. Like, and there's so much fear around. I mean, prolapse is a buzzword. There's so much fear around prolapse, and not enough fear around cardiovascular disease, osteoporosis, frailty, sarcopenia. I personally would rather deal with training around a prolapse, which is possible. You can lift heavy, and you can solve a prolapse, so you don't have to think about it anymore. But it's also possible to deal with it, just like you might deal with the history of shoulder injury. You're training around it and adapting to it, and still able to make progress without making it worse, and managing your symptoms. I'd rather deal with that in my training life than deal with not being able to train at all. The exchange there, it's a no-brainer. We have to exercise no matter what happens to us. We have, and it should be, as healthcare practitioners, it's our job to create those opportunities for people, to build that bridge for people, to make sure that they can keep exercise in their life. It is a negligence, in my opinion, to remove options like that from people.
I
Horrendous.
100% agree. Do you work with many women with prolapse? Do they come to you for that as well?
Yeah, that can be like hernia. So prolapse
Right.
is kind of like a vaginal
Yeah.
hernia. So it's a similar phenomenon to umbilical hernias and stuff. The pressure is not being managed well, and over time, it creates a prolapse situation. So the approach to that is the same. It's rebuilding where the pressure leak is, and then also making sure that we're maintaining whatever strength we can around that, around their rehab process.
Yeah. 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 And I had on a woman before who does, she works with women. She's in Colorado. She's in Boulder. She's like, I have women who are 70s who are still like picking up their kayaks and carrying them, on their heads, who have
Mhm.
prolapse, and they're not stopping. She's like,
Mhm.
we work with them. We put in slings if we need to. There are pessaries. There's all kinds of stuff that she does. And I mean, maybe you could explain a little tangentially. I have seen
Mhm.
pessary come up quite a bit in some of my Facebook groups that are complementary to this. What exactly is a pessary, and what does it do?
So they can be shaped in many different ways. The best way to get one is to be custom fitted, but they also make like over the counter type versions. But you put it in vaginally and it helps to provide support for the pelvic organs. So if someone's using like an over the counter one and it's like slipping out while they're exercising, for example, they're probably a candidate for going and getting custom fitted for
Is it
one.
like a
And
diaphragm? I mean, what does it look like?
yeah, yeah, it just, some of
Yeah.
them are like little cubes. They come in all kinds of shapes. So
Did you say
uh,
cube?
yeah, some of them are cube shaped. It
Okay.
just depends on your shape and fit. I'm not like certified in pessary
Yeah,
fitting
yeah.
or anything like that. If I'm working with prolapse, it's usually stage 1 or 2. Like we're catching it early after
Yeah.
surgery. But people that need pessaries, they can be shaped all kinds of ways. Some of them are like little rings, little discs, and they just help to provide the support that their pelvic floor isn't providing. It also depends on what kind of prolapse. So if you still have a uterus, you can have a uterine prolapse, you can bladder prolapse. It'll be shaped differently depending on what organs are prolapsing. So if it's a rectal prolapse, it might be shaped in a way to emphasize the support
Yeah.
backward. Some, depending on the severity, some people wear them all the time. Like
Hmm.
anytime they're up and at it, living life at all, they're wearing one. If someone has a worse stage prolapse, some people only use them for exercise to help provide support. Or on the topic of external tools, another thing that I think a lot of people don't realize exists are bladder supports. So they make disposable and reusable ones, and it's kind of like a tampon applicator, and it kind of looks like an IUD. Like it's about the size. It's a small little thing, and it goes in vaginally and helps to put pressure towards the urethra to help keep the urethra closed to avoid leaking during activity for
Hmm.
people that are maybe not ready to pursue pelvic PT, not ready to, just in the midst of all of this. It can be a really valuable tool to keep
And
your
where do they
pants dry.
find that?
You can buy them on Amazon. So
Oh, really?
the disposable
Oh,
brand is Poise, that makes like
okay.
underwear and stuff. So
Yeah.
Poise makes them, and then the primary brand for the reusable one is called
It's called what? I'm sorry.
Revive.
Gotcha.
Revive bladder support.
Very cool. Have you seen, I'm sure you have, I keep, because of my work, I get all kinds of things on my Instagram, as one might imagine, but I see a lot of red light therapy. Is this something that you've seen or know anything about?
I've used it not for pelvic related purposes, but I've like gone to gyms that do red light workouts. I like to try a lot of different things, but I'm not up to date on the literature. It's not something that I use regularly or anything, but
Yeah,
they
they
are
have
getting
the
quite popular.
wands, that are red light,
Yeah.
which is like, looks interesting, but I have no idea.
Yeah. I would
Um,
pursue vaginal estrogen before trying to
I
rejuvenate with
think
the red
I think
light.
that's very wise. That's very good advice. I would agree with that. Um, is there anything, I think that this has been amazing. Is there anything that you wanted to make sure that the audience heard that we haven't covered?
That's a great question. I think just to reemphasize, if you've had a hysterectomy,
Hmm.
and you're not feeling yourself like yourself, it doesn't mean that you're broken. It doesn't mean that what you're feeling is forever. There are paths, there is support out there. It's all about finding help and not feeling like the way that you feel a few months after surgery is forever, because it doesn't have to be. There's a long, um, it can be a long recovery process, but there are things that you can do to feel normal again.
And if you don't mind, like
Yeah.
you're looking at another surgery. What are you doing prehab wise? Like, are there tips that you give women who are going into this to help themselves be the best that they can be on the other side of it?
Yeah. If you're already having menopausal symptoms, talk to your doctor about that. Make sure that they're aware of it. Talk to them about what you should look out for. Do you need to start hormone replacement before surgery, or do you need to have it on deck? Like already, I recommend already having that conversation
Mm-hmm.
started.
Mm-hmm.
Um, Being aware that hysterectomies can um, lower the age that perimenopause starts. So,
Yep.
like with most things, we don't have great research, but it seems like a recent study found that it's about 4 years
Yeah,
earlier
I saw
onset.
that.
So it brings perimenopause into like your mid to late 30s if you've had a hysterectomy. So just being aware of that, knowing the signs of it, knowing where to turn to get help instead of just floundering after. Then, from a physical perspective, if someone already has pelvic floor issues, if they resonate with having leaking or back pain or any of these things that I've mentioned, doing what you can within the realities of your symptoms and what's going on in your life to address those things can be really helpful. So, for example, especially going into my third surgery in 3 years and pregnancy amidst all of that, I've lost a lot of strength in my adductors. So
Mm.
I'm a big fan of like Copenhagen planks and just like
Tell me what
pretty,
that is.
like when you're in a side plank position with your leg on a bench and you hold yourself up with the top leg on the bench
Oh, okay.
to
Yep.
strengthen the inner thighs,
Yep.
kind of like an inner thigh side plank.
Yeah.
Um, Adductor strength is really important for pelvic function. Through everything I've been through, I lost a lot. So a big focus of my prehab has been rebuilding that strength, which is going to help me feel better and get stronger faster after surgery. Having weak adductors, especially if you have weak adductors while going into loaded bilateral movements like squats and stuff, can put you at risk of pressure management issues that you don't need to be at risk for if you can have strong adductors. Especially if you're a heavy lifter where you're doing like near max lift, you get that adductor moment at the bottom coming out from the hole where people's knees came in. That's unavoidable. Like that, when you're max lifting, most people will have a big firing of the adductors. You want your adductors to be ready for that. You want them to be strong to keep up with the rest of you.
Yeah.
And having things that put pressure on your pelvis, like pregnancy, like large fibroids, like chronic endo bloating, can contribute to this too. But having things that put pressure on your pelvis and kind of shift your center of mass forward because they make you like bloat out and kind of pull you forward, um, that can start to weaken the adductors over time. So there's a lot of these kind of patterns that can show up for people with these disorders. So it might be strengthening the adductors. Right, you can do it's safe to do pelvic floor strengthening if you have weakness and you have fibroids or one of these conditions. If someone's having their hysterectomy for endometriosis and they're dealing with a lot of chronic pain, you can start learning how to find pelvic floor descent and find relaxation. You can use things like pelvic wands and stuff to help to um, lessen the pain as much as possible, lessen the muscular aspect of the pain as much as possible before surgery. And then any surgery involving an incision into the abdomen, strengthening the core. So for the active population, like people that already work out, already probably have some degree of core strength, I typically love things like hollow holds, hollow arch rolls on the floor where you're moving between that hollow and arch position. Um, if they do sit-ups, like if they're a CrossFitter and they're doing sit-ups regularly, making sure that their sit-ups are really good. So when you're doing a sit-up, you shouldn't like have to throw your body weight and feel like a downward pressure at the vulva. You should be able to control the full range of motion without feeling like you're pushing something out of you. So you can practice those skills before surgery. And then just generally getting strong, building strength, staying fit. If you're a lifter, doing cardio, we need cardio to feel our best. If you're a cardio athlete, doing some strength training.
Good advice for everybody.
Yeah.
Well, I
Um,
really appreciate you coming on and sharing all this. I am sure it has resonated with a lot of people. it resonated with me. I learned some things. So I wish you luck. When is your next,
No, thank you.
when is the end of the line here for the surgeries?
It's in 2 weeks and 3 days.
Oh,
It's on
okay.
2 Mondays from this coming Monday.
Well, good.
So it might be happen before this episode releases.
Well, we will send you all the healing and good vibes when it does come out. I
Thank
really
you.
appreciate it, Jocelyn. Thanks for sharing your expertise with
Yeah.
us.
Thank you so much.
Well, that's our show. Come on back next week when I sit down with former pro cyclist and current human performance and wellness consultant, Dr. Catherine Wilder, for a deep dive in how to free ourselves from body angst through and beyond menopause. It's a good one. So come on back for that. And until then, as always, stay feisty. You've been listening to Hit Play, Not Pause, a feisty menopause podcast for active, performance-minded women. I'm your host, Celine Yeager. The show is edited and produced by the strong, talented, and amazing women at Live Feisty Media. Follow us on social media at Feisty Menopause, and please help us spread the word. Screenshot and share this episode on your social media channels with the tag @FeistyMenopause. Share the show with your friends, and please subscribe, like, review, and rate this show wherever you get your podcasts. Word of mouth and good reviews make it easier for other listeners to find. Thanks for listening, and as always, stay feisty.